Yeah.
Or pertussis, also known as whooping cough, is a very contagious disease that can be deadly for babies.
Health reporter Haley Hernandez has the stern warning going to pregnant women and anyone around newborns.
Doctors want everyone to take this seriously because pertussis is preventable, yet the number of cases spiked by 15% in the most recent yearly data from the CDC.
This chart from the CDC shows an alarming trend, particularly in children under the age of 1 diagnosed with pertussis or whooping cough. OB-GYN James Barrow says babies are the most susceptible to becoming very sick from this contagious respiratory virus.
Especially in the first 2 months of life, it can be a very serious upper respiratory infection that can lead to hospitalization and even death.
Pertussis is spread from person to person through coughs and sneezes. That's why Dr. Barrow says any person planning to be around a baby needs to get the Tdap booster.
Anybody planning to have a baby should have all people that are going to be in contact with a child should be vaccinated, and the mother should have a booster in her 3rd trimester.
The CDC recommends that pregnant women get the booster with each pregnancy to pass on the immunity to her baby.
The booster actually passes the immunity to the baby because the babies do not typically start their pertussis vaccines till about 3 months. So there's a window of time between 0 and 3 months where the baby is susceptible to to whooping cough.
While vaccines do not offer 100% protection, they are the most effective preventative tool in protecting vulnerable newborns from contagious diseases.
While the trademark symptom of whooping cough is a distinct cough, it's important to know that many babies with whooping cough don't cough at all. Instead, it causes them to stop breathing and turn blue. Haley Hernandez, KPRC Channel 2 News.